Today on an all-new episode of The Doctors.
I gotta take my shirt off first.
And wait till you see the reason why. Plus,
we've melted it, we've pounded it, we've sucked it out, and now...
freeze your fat off, tighten your turkey goblet, remove your wrinkles permanently, and turn your frown upside down.
I call it the Mona Lisa smile procedure.
The must-have procedures today on The Doctors, where MD meets TV.
As always, the question I have for you is, does your body need an overhaul? Or maybe you just need a little nip and tuck, from cutting-edge treatments that can take years off your face to inches off your hips, even something to save your life. We've got the new body breakthroughs today. But first, whether you're a man or a woman, we all can fall prey to white lies. But which ones are women most prone to?
And I think women are sometimes overly honest about some stuff, and yet we still lie about other things.
Women might tell each other that you look really good, but they're lying, and you don't really look that good.
Maybe if they're having problems getting pregnant, they won't. They'll try to keep that. I don't think they'll share it.
Women have to lie to each other about their relationships, their weight, their health, because otherwise it'll be used against them.
But we never lie, right?
Oh, of course not. No way.
Well, you guys know that everybody lies. I mean, we all know that. I mean, that's a given.
Yeah.
I mean, you know, everyone lies. But really, I think what happens, I think what those women showed in the clip was that a lot of women are held to a lot of standards, especially age, and especially things about pregnancy.
So how about this whole idea that there's this quote-unquote survival lie? Like, there are situations where both men and women say something that may not be completely true as a survival instinct. And
well, I'll tell you survival lies. And I think a lot of women get asked this, where you go to an interview and they say, "Are you going to get pregnant?" I think that's an okay lie, because you shouldn't be asked that.
Well, I think where we need to go on this is that you shouldn't lie to your doctor.
Right.
I mean, we all get that in different things, but in my practice as a plastic surgeon, it's, have you had surgery before? Have you had injections? And they'll say, oh, no, no, no. Well, you have to be truthful. We don't judge.
Exactly.
We can handle the truth.
the classic example,
You can handle the truth.
especially with young women who won't admit to being sexually active.
Right.
No, I've never had sex, and the pregnancy test comes back positive.
How's that work?
It happens.
It's a miracle!
Can you explain that to me?
So women out there and at home, in a national survey, over half of women lied to their doctors. That's why we're talking about this. And the survey didn't include men. I would be willing to bet that over half of men have done the same. So men and women, when it comes to lies, never lie to your doctor.
When we see, and just so you all know out there too, when we see on your forms, like if you say how much you smoke, and we see somebody puts like half a pack, we automatically double that in our heads, because we realize that most people aren't gonna admit what they really do.
We're gonna move on to talk about marijuana in meals. The reason for this is marijuana is now a prescription substance in certain states. And what we want to talk about is why you can prepare something like lasagna or hummus with marijuana. Believe it or not, what happens is they'll grind up the marijuana buds and leaves in a grinder, in a blender. THC, which is that active mind-altering substance in marijuana, actually can leach out. It's fat soluble and will leach into oils, and those oils are then used to make these products.
Sauces, soup, whatever.
Well, I have a real problem, and a lot of it has to do with medical marijuana, because I'm seeing it in so many people just taking it like water, and I think it really has to be studied, especially if you're gonna smoke it. It's gonna be just as bad as smoking cigarettes for you. I mean, all the extra chemicals that are in there. I think before people really just start using it carte blanche, is that we really have to know how it works, just the whole pharmaceuticals of it, because how do you know smoking isn't better for you than eating it, then versus injecting it, then versus something else? We don't know the medicine of it.
One thing we do know is oftentimes if it's in food, the onset, the buzz you get is is delayed. It may not hit you for a couple of hours.
Because of the absorption?
Yeah, the absorption. Right. So you may keep eating thinking, oh, I'm not feeling it yet. I need to eat more.
People using this essentially to get high undermines the medical benefit of marijuana, which we know can increase appetite in folks who have cancer, can improve pain and a lot of chronic pain syndromes. But people who are abusing this, they are belittling the medical benefits of marijuana, and
it's being abused. But at the same time, I think the four of us are on the same page. We believe there is a legitimate place for certain patients, certain conditions.
Would people still take it if it was in a pill form and it didn't give you a high?
Apparently, a lot of people say they don't get the same effect as getting
smoking it. They don't get the same effect.
So, next topic, can you freeze fat away? A lot of people don't know this, but fat cells can actually freeze at a little bit of a higher temperature than your skin. And there's a new procedure called cryolipolysis. Not FDA approved, but they're taking a device, you pinch part of the skin, and apparently the device freezes the fat cells underneath your skin, killing off those fat cells without killing off anything else. And they say it may improve that lower underneath your skin layer of fat.
I mean, it's just one more thing we've done to remove that unwanted fat. We've melted it, we've pounded it, we've sucked it out, and now we're freezing it out. But the difference in this freezing point between skin and the fat, I'm afraid, is close. That you're going to get into problems because we know that cold can burn your skin just like heat can. So, not approved yet. They're doing clinical trials. But cool, before you say it, Travis, it's not a substitute for diet and exercise.
Coming up, what if I told you there was a camera that could look through your skin and could detect a medical problem before it even starts? Well, it absolutely exists. I'm putting it to the test on my own body in just a minute. Plus, a new way to tighten that frustrating fat many women get underneath their necks. Stay with us.
I see that you do have several moles. That's something that should be taken very seriously. In some skin cancers, we see very rapid blood flow.
And later.
What's called the pedometer. It calculates the duration of your intimate session.
Starting off a little, just kind of subtle. Everything's going, We're back with brand new body breakthroughs that you need to know. And in just a minute, I'm going to undergo a new procedure that could save the life of someone watching right now. But it's a busy day. As you can see, Dr. Orton's backstage in our procedure room as we speak, getting ready to show us an exciting procedure of his own. Take a look at this picture. If you've got a turkey gobble under your neck and you're embarrassed about it, we're going to show you how you can lose it for good. But first, I'm here with dermatologist Dr. Kelly Nelson, who's going to tell us all about a new life-saving technology. She's got it here, and we're going to try it out on me. So thank you, Dr. Nelson, for joining us.
No, it's my pleasure.
So I am really excited about this because I'm a guy who I have a lot of moles, and you often worry about could they be cancerous or not. So how does this technology work in terms of determining whether a mole may be cancerous?
Right. So as you know, Travis, up till now, the only way we've been able to determine if something is of concern or not is to take a biopsy of it or a sample. It involves numbing the skin, cutting into the skin. People are really nervous about that. Who wouldn't be?
Who wants that if you don't need it?
Exactly. So this microscope uses a laser light to look into the skin, almost like a camera that just lets us see what's going on.
So I've got a few moles on my back that have been growing a little bit. And they look okay to me, but is this a good technology for those? And if so, should we do it real time?
I think we should.
All right.
Let's do it.
So I am going to I got to take my shirt off first.
All right, so I'm just going to take a good look at your back here, and I see that you do have several moles. So what I'm going to do, I'm just going to attach this little ring to your skin. It's not going to hurt at all. I put a little drop of mineral oil on your skin. So that goes in just like that. So then this just links right in, just like that. The good thing about the imaging is that it doesn't hurt. It doesn't destroy any tissue, but it lets us get an idea of what's going on underneath the skin surface. So this is the very top layer of your skin.
Okay.
We can see normal skin cells. We're going to go a little bit deeper. This is a very normal architecture that we can see.
Do you see those skin cells, everyone?
Mm-hmm.
Very cool.
You can actually see some blood flow right through here. Do you see there's just a
very
little
subtle,
bit,
but I see
very
a little bit.
subtle, and that's actually really encouraging. In some skin cancers, we see very rapid blood flow, but I'm not seeing anything that looks concerning at all.
You know, we actually, I think, we have what you would see with the melanoma.
Exactly. We have a good picture of a skin cancer that has very rapid blood flow, and you can tell it looks incredibly different than what we can see here. This is very organized, very symmetric in terms of its distribution, so this looks absolutely perfect.
And what you could do is if you saw something concerning, then you would move ahead with the biopsy, is that right?
Exactly, but if you see something reassuring like this, you can avoid a biopsy so that the patient doesn't have to go through that painful procedure and then the weight of not knowing what the results will show.
Well, I love this device. Let's really quickly remind everyone at home what to worry about when it comes to moles.
Exactly. So with moles, we talk about the A, B, C, D, E's, but the most important is E, or evolution. So if you have a mole that's changing, that's something that should be taken very seriously. And so if you do experience a mole that's changing, you should really get to a doctor, either your regular doctor or a dermatologist who can take a closer look at it and sort out what's going on with that mole.
And what's great, this is absolutely pain-free. How'd I do as a patient? Okay? Thank you so very much.
No, it's my pleasure.
You can actually log on to thedoctorstv.com. We're going to have a link to download a free body mole map so you can track your moles and find free skin cancer screenings in your own area. I want to thank Dr. Nelson, and I would shake your hand if I could, but I can't. Drew, over to you in the procedure room, buddy.
That's right, Travis. We're in the procedure room. Lana Stone is back with us from the Lana Stone Med Spa up the road a piece, Calabasas, California, and our patient Lorelei. A new wrinkle buster skin tightening technique, Skin Tight. We're going to explain to you exactly what we're doing. But first, let's see what Lorelei looked before she started her treatment. You see some of that laxity, a little bit of crepiness, a little bit of banding that she's getting in the neck. So we've got a new technology for her, right?
We do.
So tell us a little bit about that.
Well, we're actually making collagen. This is the newest technology. This is the future. We are using infrared light to heat up the dermis, which is where your fibroblasts are that produce your collagen. So we get immediate collagen constriction, and then over the next 2 to 3 months, we are getting skin tightening by increasing the collagen production that thickens the skin, so it works really good for thin, loose, lax, aging skin.
Collagen, that's the key substance in your dermis to give you youthful, lustrous skin. What happens with aging as things stretch, as we get older, the collagen is not bound tightly in a triple helix. It gets stretched out. So what we're doing with the heat, we're allowing that collagen to contract and in effect form a slight injury that promotes more production of collagen. So several treatments typically, and you space those out every few weeks, right?
Yeah, they're every 4 weeks.
And no discomfort, right?
No discomfort.
All right, let's see how Lorelei looks after a series of having this done several times now. We're looking at the before, and we have Lorelei live after 3 sessions with Lana, and I know I can definitely see it. That has tightened that up. Good for you. Good job. Nice job.
Thank you.
So another non-invasive technology. It's done a nice thing for Lorelei. Travis, back to you, my friend.
Good stuff, Drew. Thank you, sir. Up next, do you have a special occasion coming up and want an easy fix to help you look your best? Well, we've got some quick procedures that can give you big results. Plus, we're going to tell you how you can transform your eyes from puffy to perky in just minutes. And guess what? It's all ahead.
There's a lot of pressure for the big day and all eyes on me.
The beauty of the product is it's causing permanent filling of the wrinkles. It'll be really a perfect filler for you.
Wow.
Today is all about new body breakthroughs, and sometimes we not only need solutions, but we need them quickly. Now, Dr. O has some last-minute plastic surgery fixes.
That's right, and first we have Laura. It's only 2 months away from her wedding. She wanted to get herself looking good for all of those wedding photos, so she had a little filler put into her nasolabial lines. Take a look.
I'm getting married in 6 months to the man of my dreams. I'm very excited, but there's a lot of pressure for the big day and all eyes on me. The photos are going to be around forever, so it's very important to have perfect pictures. When I look through the bride magazines, the beautiful dresses, the perfect skin, I've started to notice smile lines that weren't there before. I don't want to do anything extreme. Non-surgical procedures would be great for me. I just really want to look my absolute best.
Laura is an excellent candidate for Artefill. We have fairly deep nasolabial folds. Artefill is a combination of collagen and microspheres, thus causing permanent filling of the wrinkles. In your case, probably one treatment will be sufficient.
Does it hurt?
The beauty of the product is it's already mixed with a local anesthetic, so it stings just very little. It'll be really a perfect filler for you. You're going to look beautiful on your wedding day.
All right.
1, 2, 3, little pinch. We're just blending that step off between the cheek and your lip. I just put an extra little bit right there. Wow, that looks nice. Okay, time for the other side. Little pinch, 1, 2, 3. So we finished both sides. Ready? Mm-hmm. Here you go.
Wow.
All right, so let's take a look at Laura before she underwent her treatment just this week. There she is from the front, and you can see it. Her nasolabial lines, and now let's take a look at her, compare the two. So what do you think?
I feel great. I feel refreshed, and I'm ready for the big day.
I see the difference, and I think you're going to look good in those photos. So in this case, you had an Artefill injection, right? Which, you know, you've heard me talk about. Every filler that we have, this is a little bit different. It's a collagen product. The good thing is it lasts a little bit longer. This can last up to 5 years. But because it is more permanent than some of the fillers, you want to make sure that you're in the hands of somebody who's doing it regularly and knows where to put it.
Good luck on your big day.
Thank you.
Next, we have an email that makes me feel lucky that I'm a guy. Deborah from Atlanta, Georgia writes, Dear Dr. Orden, my 40th birthday is coming up, and I want to wear a flirty, strapless dress, but I have a little pocket of armpit fat that bulges out whenever I wear one. I just hate it. Please tell me you have a solution.
Well, I do. Another quick plastic surgery fix before that big event. In this case, a 40th birthday. And Travis, I don't know if you're aware of it, but women hate that corset overflow. Do you know what that is?
I do now.
Well, we have a solution for that. Pretty simple thing to do. I would do liposuction. In this case, I would use a syringe. So not using an aspiration vacuum device, I can actually do a liposuction technique. We call it the syringe technique. You can do it under local anesthesia.
Because the reality is you can't really do spot treatments, working out to get rid of that.
Well, for women, and there's a lot of thin, beautiful women that we see out there on the red carpet that have this problem. We had Halle Berry, and we also had Katherine Heigl we have a photo of to show that these gorgeous, thin women are showing a little bit of their corset overflow.
So some is natural.
Well, yeah, I think as you get older, part of it is a little bit of loose skin, but for a lot of women, the fat wants to go into that armpit area. I'm going to show you how it works. I make a tiny incision right in the natural crease of the armpit with the liposuction cannula, local anesthetic. My patient isn't going to feel this. I go in, and we do a liposuction technique. Voila, you're seeing that corset overflow disappear right before our eyes. This is similar to surgery. We put them in a compression garment for a couple weeks. That's going to allow that to shrink down, and that'll take care of that problem.
Now, another thing people worry about when they have big events Drew, it's taking pictures.
It is, and when you smile in a picture, if you don't have any lip, or if you have that kind of lip that frowns, that gives you sort of an angry, sneering look, people don't like that in their pictures, especially for a big event. So we're going to show you what we can do. I call it the Mona Lisa smile procedure. What I do, I inject filler into the corner of the mouth, right at the hinge of the lip, and I take a downturned lip to an outturned lip. You can see that on the graphic there, that by plumping the hinge point at the corner, a more attractive smile. And you know what? And we're actually going to do it right now.
And I love it when we have quick fixes like this, because we can actually do it on stage. And we're here with Sarissa, who, can you tell everyone why you don't like your smile?
It just always looks like I'm frowning. It just always looks like I'm unhappy, even if I'm in a good mood. My family always asks me, are you okay? Is there something wrong?
Why are you so angry?
Yeah, and I'm not an
And
angry
you're not.
person.
You're a happy person.
Very happy.
Well, let's see if we can fix that for you.
So this is going to be a real-time procedure.
Yep.
You're numbed up, just so everyone knows.
She's had a little numbing cream on, but the great thing is we're using Juvederm Ultra, which is mixed with a little bit of local anesthetic, so this is going to have a numbing effect as we go, hopefully.
You ready?
Ready.
Right in here, the corner of the lip, you okay?
Mm-hmm.
And then what I do, without removing the needle, I fill in a C-shaped way. We're also going to enhance the lip there as part of this. That's okay with you, right?
Mm-hmm.
You're all right? You see that difference right there, Travis? There.
Dr. Drew is going to finish your procedure as we go to break. And like you said, this is a quick 5-10 minute procedure called the Mona Lisa Smile, invented by Dr. Worden. Up next, you've heard of the lap band and gastric bypass surgery, but is a new implantable balloon the secret to shedding those extra pounds? We'll find out after the break.
There's really no surgery, no cutting, no side effects from medications.
And I want everyone to take a look at Charla from before. And Charla, come on out. Today we're bringing you the latest in body breakthroughs, and with the obesity epidemic at a dangerous all-time high, doctors are searching for new ways to intervene. Dr. Sanjeev Kela is a plastic surgeon who's one of only a handful of doctors performing a brand new weight loss procedure. Now, I have to warn you, this is a procedure, it's not FDA approved here in the US. You cannot get it done here, but it is approved in Canada, where Dr. Kela is from. So explain to us what this is all about.
Yeah, well, Travis, this is the Intragastric Balloon. It's a brand new procedure for weight loss. And what we do is we insert a balloon full of water in your stomach. And it just fills your stomach, makes you feel unbelievably full, so you don't want to eat. And in 6 months, people lose an average of 40 to 60 pounds. And that's how simple it is. There's really no surgery, no cutting, no side effects from medications, and that's the appeal of this product.
The old way was either a formal operation, the bypass, or a banding, both of which are invasive. So this is basically just passing a tube, swallowing something.
You're absolutely right. It's just basically a 10-minute procedure where we sedate you, pass the tube in, and we fill you up with a balloon so you feel full.
Looks like a breast implant.
It actually is.
You've
very
come
similar.
up with something.
It's very similar.
Well, it's the same mentality behind gastric bypasses. You're creating the sensation of feeling full sooner, with the idea, of course, that you'll decrease the amount of food you're eating. This is all about jump starting. It lasts for 6 months, and we actually have a patient of Dr. Kela's here. Charla is one of his patients. She was at 222 pounds before undergoing gastric ballooning, and I want everyone to take a look at Charla from before. And Charla, come on out. I want everyone to look once again at the before and after. And so how much weight did you lose with the procedure?
I lost about 50 pounds.
And this is what I love about your story in particular. This is a procedure to jumpstart a lifestyle change that you've continued. This was your jumpstart, but now I understand you're eating right, you're exercising more, doing the things you have to do, because it's so cool. It's a jumpstart procedure.
So I'm sure, Dr. Taylor, that's part of the deal, right?
That's how it works, because weight loss is about changing your life, your whole lifestyle, your eating and your diet, your exercise, everything. But it's hard to do when you're trying to do it with a diet. But with the balloon, you have a much easier way to do that because it helps you feel full. So automatically you eat less and it retrains you.
Any downsides, complications?
Well, very little compared to the other procedures. I mean, one is if the balloon ruptures, then it could potentially go down and get stuck. And that's a surgery. So we put a blue dye in the balloon water. So if you get a blue stool or blue urine, then you know that, hey, something went wrong. So you call us up, we take it out and put a new balloon in. That's never happened in our experience, but in 6 months. So that's why we leave them in for 6 months and take them out.
Thank you so much for showing this to us, but I do have to note that, again, different kinds of gastric ballooning are approved in Canada, Australia, and parts of Europe and Asia, but it's currently in clinical trials in the United States. It may be approved here one day if it is found to be safe and effective here. Thank you both again, and continued success with you. Next, we're putting 2 new gadgets that promise amazing weight loss and better sex to the test. Does it sound too good to be true? Well, there is a catch. What is it? Find out after the break.
I think, you know, having your weight publicly, that would drive me nuts.
I actually, every day before I would get on the WIThings scale, I would step on my regular one.
We're back and giving you a first look at the newest body breakthroughs, and we needed some help to try out this first one.
I've been a dancer my entire life, and so I'm constantly being made aware of my body. I'm what they call a yo-yo dieter. I fluctuate about 10 pounds depending on what month or week or day it is. I love Mexican food. It is my #1 weakness. I'm a sucker for peanut butter. You know, living alone, nobody else knows what I'm eating.
Bo, the one thing you need is accountability. So there's a new trend I want you to try out and see if it works for you. Now, you're on Twitter, right?
Oh yeah, I love to tweet.
So here's the challenge. This is a new scale that every time you get on it, it tells you your weight, but it also tweets your weight to all your followers, your friends, your family.
Are you serious?
Yeah.
Everyone?
Everyone. Now, I don't want to make you crazy and make you starve yourself and drop an unhealthy amount of weight, but it might help you think twice before eating a late-night burrito, knowing you have to weigh in the next morning. You're up for the challenge?
Oh, most definitely. This should be interesting.
It's 1 week later. Bo is here. We're going to talk to her in just a minute. First things first, Jim, you have a few of Bo's tweets, do you not?
This has kind of been fun following her progress here. Here's Bo's initial tweeted weight. It was 165.6 pounds. Then later on she tweeted, "I'm definitely going running tomorrow before I hop on the scale." So already she's getting that, you know, kind of motivation. And then a few days later she tweets, "Glad to know I can survive without copious amounts of Mexican food and peanut butter. Making healthier food choices. Bye-bye, chub." So cool. And then a few days after that, she weighed in at 163.5 pounds, so down over 2 pounds there. It's called the WIThings scale, and this is what it looks like. Looks like a normal scale, but it's all about accountability. It's just another tool you can use, knowing that all your friends are gonna, and all my friends now, since I'm following you, are gonna see, you know, if you're making progress, if you're not, and you know, I think it's kind of a cool thing.
Oh my God, I like the accountability. Actually, I'll have patients come to my office and weigh in, but I think, you know, having your weight publicly, that would drive me nuts. I mean, how did it work for you?
It really wasn't bad for me. I mean, I'm walking around every day. People can tell I'm not like some beanpole, so it wasn't embarrassing in that sense. But it was more of like a competition thing, like, you know, that competitive edge it gave me to like give it out to the public and see it there, and I didn't want people to think I wasn't making any effort towards it, so.
Can you turn off the public thing if you're like, oh, forget that, this isn't working?
Don't know.
Well, I actually, every day before I would get on the WIThings scale, I would step on my regular one to make sure I was ready to go and do that.
And so it was easy that way. But no, it's connected to Wi-Fi, so.
Did your friends help you on the tweets? Did they support you?
Yeah,
Did you get a lot of support
my
from
best
people?
friend, she's like, you can do it, I believe in you.
Oh,
like, people were, like, responding to me and stuff. So it was a lot of fun.
So maybe this jump-started
Oh, definitely.
eating healthier, like you mentioned, because one of the things I do have to say, you got to be a little bit careful. Focusing on just the number is not necessarily a good thing, because everyone's weight is going to fluctuate from day to day. Water weight, in fact, from hour to hour can fluctuate. And so it's really important, especially if you're adding working out, you can actually adjust your body fat percentage, can become more lean body mass, which weighs more. So your body weight can change in small amounts, and yet your health can be increasing dramatically. So you don't want to over-focus on how much weight you're losing. You want to focus more on the health that you're gaining. It sounds like you're doing all the right things.
For being such a good sport and putting your weight loss journey out on Twitter for the whole world to see, we're actually going to give you a month of the Slender Zone gourmet food delivery from Chef Sharon. So that's going to help you kind of stay on track.
When you talk about pressure, if you think putting your weight online for people to see, if you think that's embarrassing, what about this new iPhone app? It rates your performance in the bedroom and posts it on Facebook.
That's a lot of pressure.
That could either get you dates or no dates.
Or no, yeah. Or it could either enhance your performance. Exactly.
So tell us what this is,
decrease
Lise.
your performance. I don't know. Well, it's called the pedometer. And what it does is it calculates the duration of your intimate session. And what I love about this is you can do multiplayer or one player.
Okay. I don't understand. Yes, you do.
Well, this is what you do. So this is how it works. So you turn it on, and then you turn your partner on, and then you put it about 20 inches away from the action, and it sort of, you shake the bed. I don't know if you're really shaking is really a good thing, but because it's more about what you do, not how long it is. But anyway.
And we actually have Jason and Meredith here. They put this pedometer to the test last night. So, what did you all think of this?
I liked it. We thought it was fun.
It was a fun toy. Really.
So you just laid it next to you in bed, basically?
He set it on the corner of the bed.
Did he shake you a little bit more so he would get a better score on his pedometer?
I kind of knew what the stats were going for. You know, I knew it was timing us.
Well, really what it does is it also calculates the calories, how many calories.
So we actually have a little performance graph. It looks like an EKG, a heart's electrical rhythm. This is essentially the bed, I think, going up and down here last night for you two. To start, starting off with a little movement, and then, well, you know, just kind of subtle. Everything's going, oh, hey!
There's some stuff going on.
A little consistency there. And, whoa, now things are really hot and heavy. But what's funny about this, according to this graph, you guys lasted for 26 minutes and 52 seconds. It said you burned 584 calories. I don't know anyone who's burned 584 calories having sex, but if you did,
26 minutes.
you guys deserve some sort of medal.
He's just like patting himself, yeah. But getting back to the health thing, we know that, that sex is very good for you. It can decrease your blood pressure, specifically the diastolic, which is the bottom number of the blood pressure, increase your immune system, decrease heart attacks and things like that. So it's very good for you. So it's sex. That's what's for dinner. And it's a good thing for you.
Well, you can find out more about the scale that tweets your weight, as well as the pedometer, at thedoctorstv.com. Coming up, some surprising home remedies for healthier hair, and you would never expect these. Stay here. It's time for our Everyday Health from A to Z segment. Today's letter is H for hair, and we've got some surprising home remedies for healthier hair. I'm going to start with aspirin, believe it or not. Some people say that crushing up a tablet of aspirin, putting it in your shampoo bottle, may help with dandruff. So we're going to start off with a little acid-base lesson. We've never talked about this. pH ranges from 1 to 14. 7 is neutral. The lower the pH, the more acidic. Your hair is supposed to be between about 4.5 to 5.5 pH, which means it's slightly acidic. Well, the aspirin, if you crush it up and put it in there, it can lower the pH of certain shampoos. And they say that can help stabilize dandruff, which dandruff is essentially just flaking of your scalp. So, Lisa, some shampoos actually already have Aspirin is also known as salicylic acid. Some shampoos actually have a little bit of salicylic acid.
Right, there's a lot of things over the counter that can be very good for dandruff. So even though we're talking about, you know, natural things, you can buy a lot of things, but you have to be very careful because a lot of times those dandruff shampoos can actually strip the hair and make it very, very dry. So you may want to use an extra strong conditioner with it. And even these natural things will do some of that as well. So you might want to use a little conditioner to back that up.
I have a feeling this one might dry your hair out a little bit, but it's vodka. And they say that vodka actually can help increase the shine of your hair by kind of stripping the hair of all the buildup that you get from some of the products and some of the minerals in the water. You know, kind of helps strip the hair off and you know, might help a little bit.
You look in the mirror and you're like,
intentionally.
Wow, my hair looks good.
Well, the only thing about that is if you go to work and you smell like vodka, I mean, it may be a little...
It's gonna... The vodka can
That was after I put vodka on my hair.
There you go.
That was a good hair day for me.
It made it nice and long and luscious.
But they say the vodka can also clean off your scalp, which will help stimulate the hair follicles and may help them grow a little bit too.
Alcohol,
so yeah, but you're not going to do this all the time. Only like twice a month, but just a little bit of vodka in your shampoo.
I've got to tell you, I'm not going to do that. It's not for me.
And for those
Well,
of you with naturally oily hair, girl, you got some oily hair here.
Going on there, yeah.
Witch hazel, which is a natural astringent product, what it does, actually applying it to the hair, to the roots, closes those pores so you have less sebum production. I mean, you have pores, you have sebaceous glands in your scalp as well as on your face. That's why people that have particularly greasy hair, it's just an overproduction. So use a little witch hazel, which contains alcohol and the witch hazel itself. Give it a shot. She's already looking better.
You finish up, Drew. You keep going, buddy. Well, for more information, you can go to thedoctorstv.com or visit everydayhealth.com. Coming up, we're going to reveal how you can get rid of those dark circles under your eyes in just a few minutes. It does sound too good to be true, but it's not, and we're going to tell you how you can do it after the break.
Getting hemorrhoids while you're pregnant is very common and can also be very uncomfortable. But on today's Prescription for Health by our friends at CVS Pharmacy, we're going to give you tips on how to ease the discomfort of hemorrhoids. Just because you're pregnant doesn't mean you have to put up with itchy, swollen pains of hemorrhoids. Here are a few tips. My first piece of advice is to invest in a sitz bath and soak your bottom in warm water for 10 to 20 minutes several times a day. Make sure to dry off really well to avoid any further irritation, and when using the bathroom, skip the harsh toilet paper. Instead, use a moist towelette or medicated pad. But if you need even more relief, apply an ice pack or cold compress for 10 minutes about 4 times a day. And talk to your doctor about over-the-counter medications for relief as well. As always, remember to call your doctor immediately if you experience any complications during your pregnancy.
There's a brand new solution for dark, puffy eyes. Drew, tell us about it.
That's right, Travis. Nobody likes getting those fine lines, dark circles, puffiness around the eyes. Probably the single biggest place that shows on your face. Your eyes look good today, Jimbo. But I may have to give you a treatment. So what it's called is the Clarisonic Opal Sonic Infusion System. Let me fire this thing up. Hear that?
Yeah.
You put serum on it and you put it in the area where you want to treat it. And what it does, it's a sonic action that actually helps penetration of whatever particular serum you're using. I'm using the C serum.
Lisa, would you try something like this too?
So it's a really fine vibration.
I absolutely love the Clarisonic product.
I like that.
It's that sonic action, helps penetration of the product, but I think it also stimulates circulation, which is good stuff.
Definitely stimulates circulation.
And we actually have some before and after pictures of somebody, nothing more than getting multiple facials using the Clarisonic Opal Infusion System before and after. You see a little bit of softening around the eyes, subtle, natural, non-invasive.
Ladies and gentlemen, you're all going home with the Clarisonic Opal.
You're gonna like this.
Well, for more information on today's show, log on to thedoctorstv.com. And remember this, when it comes to breakthroughs, you have to do your own research. Just because it's brand new doesn't make it right for you. Those are doctor's orders. Thank you so much for watching, and have a wonderful day.